patients come with so many challenges sometimes and so many different things that we could be focusing on, it's hard to know where to start. So for providers who have limited time, and I think that's all of us, one thing to do or one strategy to consider is having a single open-ended question and saying, what's the biggest challenge you see to implementing what we've just talked about today?
Let me give an example of a closed-ended question. You'd like to be on the insulin pump, wouldn't you? So it's closed-ended because the answer is either yes or no. An open-ended question would be one like, can you tell me the pluses and minuses of using an insulin pump for you? What are some things you would like to know about the insulin pump that you don't know now? How can I help you learn those things?
The patient should be given the information. You certainly may offer your thoughts on the subject, but again, it shouldn't be just to drive your view. It should be the discussion, the conversation should help you and the patient determine the best course of action for them. But ultimately, the power must be theirs.
There's a misperception, I think, that providers think, I don't have time to do this. And actually, it actually saves time. Some of the patient-provider communication studies that have been reported show that actually this saves time if it's done correctly.
Again, I think the most important thing is to treat people with respect and engage them in a conversation. I mean, they're the ones that are living with the diabetes. As a healthcare provider, at best, you're a coach. Though the coaches can have all kinds of different styles, at the end of the day, you can only be a good coach if you can engage your student, your pupil, the athlete. They're the ones that have to do it. All you can do is give them advice and direction.
There are a number of resources that are available to providers in trying to help their patients feel more comfortable engaged in shared decision making and to help themselves and their teams be more comfortable engaging in shared decision making. Certainly, the National Diabetes Education Program has a number of resources. It has been a primary goal of the Agency for Healthcare Research and Quality. So AHRQ has a number of resources for clinicians and healthcare providers. NIH has a number of resources, the American Diabetes Association. There's no shortage of practical tools, videos, handouts, patient information, resources that providers can use to help them and their staff feel more comfortable welcoming patients into a shared decision-making encounter.